And one day the surgeon said to me, someday Michele is going to come up with something we can just squirt into these joints and fix them.
Welcome to Nano Matters, the podcast that explores examples of nanotechnology. I'm Lisa Friedersdorf, Director of the National Nanotechnology Coordination Office. Here with me today is Michele Marcolongo, Professor of Materials Science and Engineering at Drexel University. Her lab uses nanotechnology to help fight diseases associated with aging, like osteoarthritis. So Michele, can you tell us a little bit about osteoarthritis and what causes it?
We don't fully understand what causes arthritis, but we do know some factors that may be responsible are inflammation as well as mechanical loading. Once the inflammation is started, the result is really a breakdown of the structural biomolecules in the cartilage that are responsible for keeping it both strong as well as frictionless and letting you walk without any pain. So the things that you usually see with arthritis are pain, swelling, and lack of mobility of the joint.
So how does nanotechnology play a role in treating osteoarthritis?
Well, one of the molecules that breaks down due to the inflammation is a family of molecules called proteoglycans. And those molecules are nano molecules that look like bottle brushes, a molecular bottle brush, just like you would use to clean out a baby's bottle or a test tube. Those proteoglycans are responsible for holding water in your tissues and sequestering that water or binding to it. And when they break down, you start to lose the hydration in your cartilage, which is more or less about 70% water, which leads to a lot of degeneration and breakdown. And so in our lab, what we've been doing is making mimics to those bottle brush molecules called biomimetic proteoglycans and infusing them into cartilage to molecularly repair the tissue.
So are these molecular brushes that you synthesize injected into the joint through a needle?
Yes, so far we've been injecting them into the joint just with a needle, like you would get a steroid injection, say, into your knee or hyaluronic acid injection. So there's already a protocol for how to do that. When we inject these into the joint space, then they diffuse up into the cartilage.
So what is the status of your work on this treatment? I have to say that I actually suffer from osteoarthritis and I've tried the steroids and other treatments, and this is really fascinating. How soon is it something I could ask my doctor for?
Well, we're in the preclinical phase right now, so we're still doing some proofs of concept, but we're seeing lots of positive results in that we can change the mechanical properties of the cartilage after we introduce these molecules in there, making the cartilage stiffer and giving it more resilience and higher hydration levels. So I'm hopeful that it won't be too long, Lisa.
That's great. It's definitely impacting the mileage I'm able to run. So what inspired you to do work in diseases of aging?
When I was a graduate student in bioengineering, I used to go into the surgery suites frequently with the orthopedic surgeons and see them do what we call salvage procedures, which are like total knee replacements or total hip replacements, where there's a lot of carpentry involved with saws and hammers and things like that. And it's just it's helpful surgeries, getting a knee replacement or hip replacement, but very invasive surgeries. And one day the surgeon said to me, someday Michele is going to come up with something we can just squirt into these joints and fix them. And from that point on, I sort of always thought about how we could possibly do that. How could we come up with something more minimally invasive so people don't have to suffer through all the different degenerative stages of arthritis that lead you to the point where you do need a total joint replacement eventually to alleviate the pain and give you some motion back.
Are there other diseases that can be treated with this type of technology?
Yeah, we've been looking into treating back pain, which is a degeneration of the intervertebral discs between your vertebrae. And that looks promising in the same way that cartilage does. And we've also been looking at it to treat urinary incontinence, which is another disease of aging. And that also looks very promising. We're also able to modulate the properties of that tissue to give it more resilience and was very well tolerated.
Is this technique with the molecular brushes similar to a scaffold that will help the cartilage regrow, or is it entirely new tissue that essentially you put in this technique?
Yeah, with this one, it's a little bit different from tissue engineering in that what we're doing is when you tissue engineer, you try to get the cells to regenerate the tissue. But sometimes when you're in a highly inflammatory environment with a lot of cytokines that are trying to break down the tissue all the time, it's difficult to tissue engineer a positive response because of the microenvironment. So in these aggressive cases, we're using the molecules just that they're very similar to what the cells would make themselves to just molecularly repair the tissue. Just put them back in there and kind of reinforce them or repair what's been missing that was broken down by those enzymes. So it's a little different, although it would definitely complement tissue engineering.
Do you have a sense of how long a treatment such as this would last? When it would need to be repeated?
No, but that is a very good question. We've been thinking of that, and I think we will have some answers to that probably pretty soon.
Well, Michele, I just want to thank you for sharing with us this really fascinating application and explaining how you're using nanotechnology to help folks with osteoarthritis. Do you have any closing thoughts that you'd like to share with our listeners?
I would say that nanotechnology has a tremendous potential to drive the practice of healthcare, especially in these kinds of reparative strategies, early intervention strategies, things that will avoid surgery and limit the prolonged suffering most people go through before they go to a major surgery. So I hope that a lot of people out there will think about using their nanotechnology for the power of healthcare.